the very first question that we had advertised that we were going to talk about
Mhm.
is, the difference between coronary artery disease and peripheral artery disease, and why PAD
Mhm.
patients are at higher risk of CAD.
Yeah, so it's a good question. I think what we have to understand is the process, and I alluded to this before, of all three areas. All of them start with atherosclerosis, hardening of the arteries. This is all a continuation of one process. This process doesn't just happen in one circulatory area; it happens all over. High blood pressure affects all parts of the bodies. Your heart has to work extra hard against that high blood pressure. Again, atherosclerosis makes these tubes very rigid. Usually they're very elastic. So it's easier to pump blood through an elastic tube than it is a rigid tube. And so your heart has to work harder. In the legs, you're working against gravity, you're working with gravity. And those, again, arteries aren't elastic. So you're having to pump more blood through a very smaller orifice that's blocked off. It's like putting a finger over a garden hose. It comes at a higher pressure. Same thing in the brain with patients who have circulation problems in the brain. So that's why there's a correlation between patients in this context of CAD and PAD. And usually the number they throw out there's a 30% correlation. I think there's a lot more. And so a patient who comes in who has a history of CAD, who has all the risk factors, always a good idea. This is what I do. I ask them about the walking pain. I ask them about any pain they have in their legs. I check their pulses and their feet, the pulse on the top of the foot and then the inner ankle. Those are the two of the main pulses. And if there's any indication that those pulses are abnormal or low, get an ABI, get an arterial Doppler or ultrasound, especially in that setting because of the correlation. It's the continuing process. Atherosclerosis, hardening of the arteries, which causes a progressive narrowing. And again, this is a process that happens all over the body. So we should understand that it doesn't just happen in one area, it happens in different areas. So that's where the correlation comes from.